This has a lot to do with culture. If the drug is marketed as a glucose-lowering drug, then you're going to give it to people with diabetes. Now we know it's far more than a glucose-lowering drug, and we also know from a side effect profile, if in advanced kidney disease, a lot of the stuff that was thought to be associated with this drug class is not true. Acute kidney injury was seen, but nowhere near as much as was thought. Hyperkalemia is not seen at all. There was concern about fractures, not seen anywhere. And the people that got one of the greatest benefits were the people that came into the trial with amputations. And those people did not have a higher risk of amputations. So I think a lot of the original scary tactics never was borne out to be true in the highest risk group that you would expect to see. So the endocrinologist can feel free to give this for glycemic control. There's nothing wrong with that. And in fact, the new label for canagliflozin is to really get it down to a GFR of 30, you can give it. And in fact, you can continue to give it if it goes below 30. The cardiologist has the heart failure benefit. The data are very clear, and so there's no reason for the cardiologist not to give it. However, there is a concern about diabetic ketoacidosis amongst people taking insulin who stop their insulin either because they got sick or for whatever reason. And as long as they don't stop their insulin, that's not going to be an issue. And for the primary care physician, the reality is these drugs protect kidneys and save lives. And so there's no reason not to give these drugs because the side effects, the benefit far outweighs the risk based on the analysis in this highest risk group. So I think the highlights of the meeting is we're getting a lot more information about a new class of drugs called HIF inhibitors for anemia, and there's data being presented on that. We're getting a lot of information about uric acid and outcome trials looking at allopurinol and progression of disease. The credence, I think, is the gorilla in the room, and you can argue that that's a bias of mine, but I think it really is the gorilla in the room. And then there's a lot of insights into novel mechanisms related to kidney disease related issues, and that grows every year. I'm not sure that's a buzz, but all of this information grows, and I think that cumulatively, if you apply this information when you can apply it, you'll have better protection of kidney function.